The funerals this week of the children gunned down at the Sandy Hook Elementary School in Newtown, Connecticut, still has the nation focused on the tragic consequences of our culture of gun violence. The horrible massacre of 20 6- and 7-year-old children in a suburban Connecticut school has jump-started a long-overdue debate on gun violence and gun culture in America. President Barack Obama promised quick action.
That's why I've asked the Vice President to lead an effort that includes members of my cabinet and outside organizations to come up with a set of concrete proposals no later than January, proposals that I then intend to push without delay.
But the Sandy Hook tragedy obscures a deadly epidemic in the black community has been dealing with for decades. Too many guns, not enough mental health services, and too little power to tackle those problems in a meaningful way. While shocking, the 26 women and children killed in Newtown is less than the 80 African American boys between the ages of 15 and 19 who were killed per month by gun violence in 2008 and 2009. Again, per month. To be clear, the 20 Sandy Hook children are innocents who didn't deserve to die in a senseless tragedy. But a large number of black homicide victims aren't gang members or drug dealers, but children who died doing nothing wrong. 182 black children between the ages of 1 and 9 were killed in 2010. That's according to the National Center for Injury Prevention and Control. That's a Newtown-sized tragedy. 20 innocent children killed every 40 days in the black community. President Obama, calling for action, said mental health must be considered along with gun control to help stop mass shootings.
We're going to need to work on making access to mental health care at least as easy as access to a gun. We're going to need to look more closely at a culture that all too often glorifies guns and violence. And any actions we must take must begin inside the home and inside our hearts.
But like other forms of health care, that is harder to come by in America, and especially in the black community. According to the Federal Substance Abuse and Mental Health Services Administration, African Americans have less access to and availability of mental health services and are less likely to use mental health services. And when they do, they tend to receive lower quality services than whites. Joining us to discuss gun violence and mental health in America, psychologist Dr. Jeff Gardere in New York. Here in Washington, D.C., Dr. Ron Bailey, chair of the Department of Psychiatry at Meharry Medical College in Nashville, Tennessee, and president of the National Medical Association, and Dr. Chuck Williams, adolescent psychotherapist and a professor at Drexel University in Philadelphia, Pennsylvania. Gentlemen, welcome to the show.
Thank you.
Looking at these cases, what's interesting is that you don't see African Americans participating in such mass violence. What's the difference there in terms of how African Americans are involved in crimes involving gun violence? Then you have these mass shootings where typically they are white males.
Well, my experience has been that very often with African Americans, the issues are individual. There may be an individual conflict or difficulty between them, I think, or individuals that they're having problems with, and access to weapons of destruction, guns and the like, can be used in those type settings. Clearly, when we speak about mental illness and concerns regarding larger groups, such as what we saw in Connecticut, we do have seen that more regularly, I think, in other settings or in other groups, when the use of those weapons are used across a wider scale. It doesn't necessarily mean that the African Americans don't have some of the same concerns or thoughts, but we haven't regularly seen them used, I think, in this large-scale type manner.
I think that also part of it is the issue of the types of violence that we see in our communities. As the doctor already mentioned, it's usually interpersonal, based upon arguments. You step on my sneaks, you talk to my girl, you disrespect me, and that tends to be one-on-one or a small group. When you have these mass shootings, this is usually a person who's trying to make a statement. You know, mental health issues notwithstanding, they're looking to get a lot of attention, so they go to a place like a movie theater or a school, and they get that attention, which is sort of the downside to discussing this, but we should still talk about it.
Jeff?
I would also say that when we're looking at African Americans, we're looking more at the inner cities, more density, and therefore the issues they have, again, as one of the doctors said, it's usually a one-on-one, but they're also coming to the attention of other people, school counselors, neighbors, and so on. In some of those isolated areas that we've seen, the rural areas, a lot of those young people are left to their own devices, perhaps come from a little bit more wealth, are not recognized by the mental health system, and spend an awful lot of time alone, giving that independence, and therefore when they do release a lot of that rage because of psychosis or personality disorder, it's on a much larger scale.
It's been very interesting as I listen to people break down these issues over the past week, and you have folks who say, no, the most important issue has to do with gun control, and others say it's mental illness. Then you have folks who begin to say, no, we must take a look at video games, and the argument that I keep making is that in order for us to address this issue, it has to be holistic. You have to factor all those things in because, as Jeff said, Adam Lanza spent a whole lot of time by himself playing video games, surrounded by posters and things along those lines of killing, if you will. And so you can't confront this. That's why I keep saying there's a gun violent culture in America, and a culture means more than just one issue.
Right.
Well, absolutely. And psychiatry, we regularly address the issue of risk management. And risk management basically takes as you say, a holistic or multi-tiered perspective. If we're going to commit someone, it's not solely because of any one comment they've made. It's because of the comments they've made, their past history, what medicines they may or may not have been on, and what prior behaviors they actually have been engaged in. This is a risk management issue. We need to clearly address mental illness concerns, better funding for mental health. States have lost about $4 billion, as I understand, over the course of the last decade, and that's playing out. And persons having a harder time receiving care and receiving longer-term inpatient type care. But equally important is a holistic concern that if you are going to have difficulty, because we can't manage and prevent concerns regarding everyone, then you also want to decrease the access to these weapons, these assault weapons. So if you do have an adverse action, it won't affect 20 kids as compared to one or a smaller number. Finally, I think you also have to address concerns regarding education. We live in a culture now where the education is very negative, whether it's media, whether it's print, whether it's television or radio, whatever. Our average kids now can be exposed to 100,000 or more episodes of violence in the course of their lifetime. And although I think the First Amendment allows it to occur, and we can block it, we can also expect that it's not going to have some adverse impact on those particular individuals who will be most psychologically vulnerable based on brain impairment to act out in a negative way.
Jeff?
Yeah, I also agree that we do have to look at those who are much less vulnerable. Look, I mean, a lot of kids play violent video games. They don't go out and shoot up a bunch of people. We have to look at those kids who have mental health issues, perhaps where there is some psychosis, again, these personality disorders. We can't keep guns in those particular kinds of homes, for one. And for two, we have to look at the mental health system that is not able to work with young men, especially who are at the advent of mental illness. They don't want to take the medications. So parents have to look within themselves and try to figure out how to get them the best help, and certainly how to keep them away from living a life as being gamers in video games, in being exposed to violence.
Chuck, in this particular case, we saw this young man shoot his mother in the head. She dies. She was buried this week in a private burial. To the point that Ron made, you know you have a son with mental issues. And one of the ways, according to the reporting, that she sought to bond with him was to go to a gun range.
Right.
Then we find out that prior to this shooting, she leaves the home for a couple of days.
Right.
So you have a mentally unstable son who spends a lot of time by himself, and now you leave the home and he's spending 2 or 3 days by himself, and he has ready access to those weapons. To me, that's a perfect storm for exactly what took place.
I agree with you, Roland. You talked about using a holistic approach, and I think the president gets that, and I think that he's going to be attempting to do that along with other folks like the National Medical Association. I'm a member of the APA. Look, I have a joint faculty appointment in psychology and education. Let me pull it together for you. The reality is a lot of parents don't want to talk about the issues that their kids face. They're in denial. When I did school-based behavioral health for 7 years, it's one of the greatest challenges I face. I said, you know, this kid got into a fight. He smacked the teacher. He's hitting kids. He's not focusing. He's not sitting still. He's very anxious. Your kid has a problem. maybe he just needs, a little rest or needs some more time with his father, or I'll take the video games out. I'm saying no. As my colleagues will attest to, these are serious mental health issues. He needs to be treated. That could include medication as well as what we call the talk and cure therapy. But the other issue is this culture, again, that celebrates violence. And we don't want to talk about that because I got an Xbox. I was playing it the other day, and I got some violent video games. Although I've talked about Quentin Tarantino's movie with Jamie Foxx, I'll probably see it.
Django Unchained.
Right. So all of these things that we enjoy, and the gun enthusiasts, I don't know if you are, there's a consequence that we have to pay for having this proliferation of these assault rifles. I believe everybody has a right to hunt and to own a gun. I believe the Second Amendment is sacrosanct in a lot of ways. However, we don't need people having assault weapons to go hunting. It just doesn't make any sense.
Jeff, I want to come to you on this one because to piggyback on what Chuck just said, and I think this is what is missing in all of these shows I've watched this week, all of this conversation. I'm hearing all of these networks say we need a conversation, but folks don't want to have that conversation to say, okay, parents, okay, brothers and sisters, okay, aunts and uncles, here's your role. It seems that we're already trying to shift this thing to what kind of bill can be passed in Washington, D.C., how can we stop guns from coming in, when at the heart of it, you as an adult play a role in terms of the gun coming into the home.
Absolutely. So let's humanize this a little bit. Everyone is right on this, that as parents we have to take much more responsibility. This mother who was killed by her son, I don't want to victimize the victim, but certainly a very poor choice in trying to bond with her child with mental health issues with guns. This is where we are in denial as to what is going on with our children. But we also have to look at the reality. Part of that denial is we don't want to think there's anything wrong with our children. It's the hardest thing that we can face as a parent. And then we have to look at the other major issue, and my colleagues can attest to this. When you have an 18, 19, 20-year-old young male who is now starting to develop schizophrenia, he doesn't want to get treatment. He doesn't want to take the medications because of the side effects. And when he becomes uncontrollable to the parents because he's getting older and getting much more rageful and breaking with reality, you try to get him into an emergency room. Unless he is at that time a specific danger to himself or others, he will not be accepted into the hospital. And if he is accepted, he's there for 2 or 3 days because there's not enough bed space. He's released. He starts decompensating again. And the parents are tearing their hair out because they just don't know what to do. That's a major issue we all will have to address as mental health experts and ramp up our game to address that issue.
Final comment, real quick.
Okay, I was going to say, this is about education, too. We don't know how to embrace kids who are different. We treat them as outcasts. They're by themselves. They think of all these violent thoughts, and then we have these massacres. We have to be able to include. Inclusive education is an answer to.
Well, I'll tell you, we will certainly continue the conversation. And again, I want people to understand, you're right. We're not trying, the mother, she was shot and killed, and she's a victim. But I also say that when people say, well, the person who does it, they're going to find a way to do it anyway. And I'm saying, you probably are right, but don't make it easy. At some point, you can't say, I can't have those weapons in the house if I know I have an unstable child. Ron, Chuck, Jeff, we certainly appreciate it. Thanks so much.